if you have a robust data gathering system that's embedded within routine clinical practice internally, you have a lot of data you can look into. And one of the things I thought would be interesting to look into was how the priority of needs changed during the pandemic, when the pandemic started last year. So we looked into the dialogue data that was collected in April and May in 2019, because we had this embedded, and we found actually during the pandemic, with all the crisis going on, we still had close to 1,000 dialogue forms filled in. And what I was interested is looking into the dissatisfaction Pareto chart. If anyone is familiar with it, it sort of looks into the area that someone is most dissatisfied with, and then goes by adding each bit. So together, all the domains add up to 100%. So obviously, we focused on the outcome elements. This is not the experience part of dialogue. We focused on the first 8 questions, and we found job dissatisfaction was always the key area of dissatisfaction, with mental health coming close by behind it alongside physical health in 2019. But this changed, and accommodation and finances crept up in priority, and understandably with the anxiety that COVID created with lockdown. This is interesting because we hear a lot about the impact of COVID on mental health, and that's around mental well-being in the general population and how that's more in certain subpopulations. But within the SMI population, which is spread across genders and ethnicities, in East London is quite diverse, and different ages, it's the more sort of real life worries around what's going to happen to my earnings, what's going to happen to my house, and how am I going to carry on living if everything shuts down, was the main worry that was also being reflected within the SMI population.